Hi, this is Debbie Komisak. I am doing a video presentation on the interprofessional communication prioritization of care. I did the simulation activities, the prioritization of care, and the patient management and delegation assignments. Reflecting on that, I enjoyed the assignments. I think they were very good and useful in learning how to prioritize care and based on the symptoms and their chief complaints and so forth, and also the patient management and delegation. It's a very good tool for learning how to be a charge nurse. My experiences in where the facilities I worked, where I worked for 23 years on a pediatric floor at my local hospital, I was a charge nurse. There was me and myself and an LPN if we had two RNs. One would be in charge and the other, wouldn't be, but we didn't really do it back then like they do now. Where I work now, there's a charge nurse, and they do make the assignment on the whiteboard based on the acuity of the patients. I'm not a charge nurse right now where I work, but going back to when when we were charged, we basically did the admissions, and we just split it up half and half. One would do the admission and take the information. The other one would take the vital signs, height and weight. One would do the meds. One would do more of the charting. And it was different than the modern time. I was in charge with an LPN. We could have as many as 12, 13 patients, and it was just me and an LPN. So being in charge, I basically had to do most of the clinical work, and then the LPN would take vital signs and INOs, and sometimes help with charting, not always. So it was a different time and just a different type of work. The patient management and delegation I found challenging because I thought it was a good experience, but I enjoyed how I saw how difficult it is trying to be fair, to give assignments and based on their acuity, their illnesses, their comorbidities, and I actually didn't do too well on it on my first tries. I was able to prioritize from high to low, but giving the assignments to the nurses the first time I didn't do too well. So it was a good learning experience, I think, and for both of the simulations, I can't reflect too much on it because, like I said, as present, I'm not a charge nurse, and but it's definitely a good tool for learning to be one. And when I am a charge nurse where I work, it'll definitely come in handy. Thank you.